Welcome everyone and good evening. We are so excited to talk about rhinoplasty today and all the little intricacies and operations that are involved in rhinoplasty. It's easy to call it a nose job because that's what rhinoplasty is. But everybody's nose is a little bit different, and we're really two people squashed into one body because we're made embryologically where we're two sides. So we're all asymmetric, and we all have the things about our nose that bother us because it's this thing that sticks out from our face. And you don't hear about people talking about their beautiful rhinoplasties. You hear about the big noses and the crooked noses. So the goal of rhinoplasty is to make the nose disappear into the face so that all the other parts emerge as being so great. So come in and we'll tell you and we'll show you all the things. Don't forget that the best part of all this is the live Q&A at the end of the talk, because there you can ask all the questions that you want. It's all anonymous. Other people can't see that you're asking, so that you can get the answers, all the questions you want to know. Everything you were afraid to know or afraid to ask and were afraid to know, whatever you want to talk about, we're here to answer the questions and give you some really good information with some cool technology to help you basically have the operation without having the operation. So welcome and thanks for coming. So what is a rhinoplasty anyway? Is it a nose job? Yeah, but a nose is a fairly complicated organ and has a lot of different parts to it. So let's take a look. Here's my little friend, a sculpture that I made. And here you can see the nose. So there is the dorsum of the nose. That's the top up here. There is the tip of the nose. There is things to think about the width of the nose. And in addition, there's also what's in the back, which is the whole breathing mechanism of the nose. So the nose works both functionally, breathing, and also aesthetically, how it looks in balance. So our faces are aesthetically in thirds, 1/3, 1/3, 1/3, and in fifths, 1, 2, 3, 4, 5. So it's all about balance. So when you think about noses, it's how do you make sure that the breathing stays or gets better if it needs to, or stays good, and also how does the nose fit onto the face, because this is a nose without the rest of it. This is a nose with the rest of it. And fortunately, we spend our time having our nose on the rest of our bodies. So it's good to think about noses that work for your own, what you like, but in keeping with the rest of your face. So as we go and learn about rhinoplasty, always think about how it works with you and the rest of you. So this is the vector program, which I find to be really helpful because you can see before and afters. You can morph and see the different positioning, and it has all these many views. It's also helpful because I can adjust as you need, and we can zoom it in. It's really a good way to get a sense of, it's like having the operation without having the operation. Big and small. When you go, you can see how you can raise the tip and reduce it. Each one has a different component, and wider and narrower. So what are the benefits of rhinoplasty? Well, there is the aesthetic benefits and there is the reparative or reconstructive benefits of rhinoplasty. And it's good to think of both of those at the same time. So what is the benefits from reparative or reconstructive? That you can breathe better, that you have the ability to sleep better, and also important, not to sleep worse having the operation. So these are all important things to consider. From an aesthetic standpoint, it's so that the nose disappears into the face, so that it's not a big feature, so you can see the other parts of your face. And noses are really fun to do because they're always challenging, and yet because they're so prominently featured on our faces, it creates such a big impact for people. And I love taking the splint off after a week and seeing people's faces. Sure, the nose is still swollen, but there's this very deep satisfaction I get from seeing people so happy. So we're learning about your nose and what you don't like about your nose and what you do like about your nose, because it's always important to figure out what is it that you like and what is it you don't like. So we're going to take a look over here, and this is the inside of your nose. So these are the cartilages, upper cartilages, lower cartilages, and it's the same view but from underside. These are lower cartilages. And from the side, this is your septum. That's what makes the breathing if it's on one side or the other, because our noses really are two sides of the same story. So, and this is the septum after you peel away the cartilages. So these are all four together. So it's really good to diagnose before you treat. And so if you want to have a narrower nose, then you need to know, okay, what's causing the width? So it can be on this side. Let me give you a mirror to see. You can take a look. So when you take a look. So if you look in the mirror, you can see how the parts of your nose correspond to the pictures. So here we have the tip, and the side of the nose is called the dorsum. If you just turn your head to the side a little bit, so there should be a straight line that goes from the top down to the tip, and then if you turn to the other side, it's often people say, oh, I have my good side, my bad side. That's because we're all asymmetric and we're put together side to side. If you tilt your head up, that's where you can see if your septum is in the midline, and it's also how your nose balances with your forehead and the rest of your face. So if it's too wide, we can make it narrower here, we can make it narrower here, but you don't want it too narrow. It's very much the Goldilocks. You want it narrow, but not too narrow. You want it to be straight, but not too straight. These are all things that come into play because we're all humans and we want it to look natural, but great. What's the downtime? Well, you have a splint for a week, and then the splint comes off, and you're still swollen, and you don't see the final result for a year, but you can function pretty well after a couple weeks, but even after a week when the splint comes off. And you asked also about complications. Well, there's always a chance of bleeding and infection, low risk, but can happen. Probably the biggest risk of any cosmetic operation, including rhinoplasty, is that you're not as happy as you want to be. And that's why I work really hard before the surgery to have enough face time so we are clear exactly what your goals are, what we can achieve, what's realistic, what's unrealistic, what's balanced, and then we go together to do the operation. So you wanted to know why come here, why not go somewhere else? Well, besides, decades of experience and also the greatest technology to really see and have the operation without having the operation, so you really know what's going on. Basically, nobody cares more than you about the result except for me. And that is why I love this operation. It's a fun operation. It's always challenging, but always rewarding for the patient and for the doctor.
Thank you so much for joining us this evening for our rhinoplasty presentation. Reminder to please stay until the end. We'll have a live Q&A. It is completely anonymous, so please don't hold back. You can answer all your burning questions, and Dr. Korman will answer them. You will also receive a text at the very end to reply back if you'd like to schedule your consultation. Also, reminder, staying till the end. Everyone will be entered into a raffle, and we will reach out to you in the week to come with those winners. Thank you, everyone. Look forward to our Q&A.